Today's Thriving Thursday is sponsored by Little River Medical Center.
Good morning. Thanks for watching Living Local. It is Thriving Thursday, so I'm here at Little River Medical Center, and I'm chatting with Chris Chaplinsky. How are you doing, Chris?
Doing great. How are you today, Rainey?
I'm great. I'm excited to chat with you because this is kind of a world that I don't know. So you're the director of pharmacy here, right?
Correct.
Okay. So, you know, Little River Medical Center has kind of some cool aspects with providing a pharmacy on site. So can you tell me a little bit about that?
Yeah, we have two pharmacy locations. One of them is at our Little River site and the other one at our Carolina Forest site. And we like to use those to augment the other services that we provide. We like to say that we are one of the providers that just help make the whole level of services available for one when they would choose Little River Medical Center as their provider of medical need.
Sure. No, I love this. So, you know, people can come and get service, you know, at Little River Medical Center, and then the doctor can prescribe them something, and they can just get that from the pharmacy on site and leave with that medication, right? Exactly.
We like to make it a one-stop shop, Rainey, and you know, that gives us some unique aspects of what we can do to make sure that we're giving the level of medicine that the person needs to get better, because oftentimes at the end of a doctor's visit, really the conclusion of it is getting that transaction of that prescription.
Right.
And if folks can come to us, afford their medicine when they get done with their doctor's visit, we make sure that they get better. And that's really what the most important aspect is of being healthy, is getting better.
Absolutely.
And closing that transaction with that prescription really does help our patients make sure that they get better and get the service that they need.
Well, and it makes total sense too, because how many times, you know, before did you go and have something done and you're sick, and then you've got to make an extra stop, you know, on the way home at the pharmacy to get the medicine that you need, and you have to wait however long to get it. So, I mean, that by itself is a huge service to just have that with you when you leave.
Exactly. I mean, it's really one of those unique caveats that we have, that we can just reach back out to your provider when you're a patient here of Little River Medical Center, and if they've prescribed the most designer drug that costs, you know, $100, we can, our pharmacist and my pharmacy team are folks that really take pride in making sure that they're delivering the best quality care to you at the best affordable price. We have a lot of different programs that we try to deliver medicine to with a affordability aspect in mind, as well as getting the best therapeutic care. We deliver that by having some medicines available at zero cost for our patients. We also have competitive rates on other medications that are actually more inclusive than what you could see at other establishments. Like everybody hears about the $4 drug list at some other pharmacy locations. We do our best to try to match or exceed that. You mentioned our sliding fee level of charges. Here at Little River Medical Center, every patient that comes in has an opportunity to apply for a sliding fee. And what that does is that if you did qualify for that service, what we can do is take some pretty significant pricing power that we have with the way that we acquire prescription drugs, apply that cost of drug and deliver it to you at a lower price. So anyone that would be out there that would be not an existing Little River Medical Center patient to see our other providers that we have on site, I would encourage them to possibly look into maybe getting their first appointment with one of our providers if they're struggling with medication affordability, and then possibly give our pharmacy a try to see if we could help them get better by getting the medications that they need in order to get better.
No, that's great advice. I think a lot of times in our minds we're like, oh, the pharmacy is just people, they get the order, they make the medicine, they ship it out, you know, but you guys are really involved in kind of making sure that the patient is well taken care of.
My pharmacy team members do a lot more other than count by 5. So you might see that a lot of the times when someone's doing an expose about a pharmacy, they'll see the person with the counting tray just going back and forth and stroking those tablets. But we do a lot more than that. And what I can say is my pharmacy team members and also the rest of the staff here at Little River Medical Center really wants to make sure that the patient in front of us is what's the focus, and that we're making sure that we're delivering the best care, whether it would be within the pharmacy itself or in the office when you're having an exam with one of our providers.
Love it. Thank you so much, Chris, for chatting with me today. This is super informative and interesting to me, so thank you.
No, you're very welcome. Thank you for having me.
Yeah, of course. And of course, you guys can visit the information on your screen if you'd like to learn more about Little River Medical Center and the pharmacy. Thanks so much for watching Living Local today. We'll be right back.
Today's Thriving Thursday is sponsored by Little River Medical Center.